New York confirms more cases than any country.
9/11 was supposed to be the darkest day in New York for a generation.
A new pledge for PPE.
Everyone working in a critical role must get the PPE that they need.
And are minority ethnic groups hit harder by the virus? This is Coronavirus, the latest from the Telegraph. I'm Theodora Louloudis. New York now has more confirmed cases than any country. The state, which is home to 19.5 million people, has recorded 160,000 cases. That's 7,000 more than Spain and 17,000 more than Italy. On Friday, photos emerged of workers in hazmat suits burying coffins in a mass grave in the city. And Governor of New York, Andrew Cuomo, compared the crisis to another tragic day in the city's history.
9/11 was supposed to be the darkest day in New York for a generation. We've done everything we can since 9/11 to make sure 9/11 didn't happen again. We lose 2,753 lives on 9/11. We've lost over 7,000 lives to this crisis. I don't even have the words for it.
The Telegraph's Josie Ensor is in New York. She tells us how it became the coronavirus capital of the world.
Some suggest the answer lies in the amount of testing New York has carried out. Sure, the state has been testing at a higher rate than almost anywhere else in the US, but is still much lower per capita than in Germany, Italy, China and South Korea. Part of the answer could lie in new research reported this week. A series of studies suggested that one of the first strains of the virus to hit New York came from the UK and Europe, not China as had been suspected. But while President Donald Trump barred foreign nationals at the end of January from entering the US, if they had been in China, it was not until mid-March that similar restrictions were placed on travellers from Europe. Some also say that the lockdown restrictions here are not tight enough. Governor Andrew Cuomo took measures to close New York down, but they were not anywhere near as austere as cities like Los Angeles and San Francisco, or indeed the hardest hit parts of Europe. New York ordered all schools to close by March 18, by which time it had already recorded thousands of cases. New York is also one of the most densely populated areas of the country, and for some it's been hard to isolate and practice social distancing. There's also the issue of healthcare. On the Global Health Security Index, a report card that grades every country in its pandemic preparedness, the US has a score of 83.5, the world's highest. But during the recent outbreak, it has fared much worse than countries with universal healthcare systems. The confused new policies on whether the coronavirus treatment is free has left some confused. Many have avoided hospitals altogether for that reason.
UK health and social care workers are being urged to treat protective equipment like a precious resource. Health Secretary Matt Hancock said there's enough personal protective equipment, or PPE, to go round if it's used in line with official guidance. It follows widespread reports of shortages in hospitals and care homes amid a global squeeze on supply. But today, Mr Hancock said the UK was stepping up its efforts to meet the demand.
Every NHS hospital has received a delivery of critical PPE once every 72 hours, and over the next week we're making that daily. This Herculean effort of enormous operational complexity to get the right piece of equipment to the right person at the right moment, I pay tribute to the enormous efforts of all those who are making it happen.
Universities, tech companies and 3D printing enthusiasts with their own printers are responding to the PPE shortage by making it themselves. 3D printing can often be turned around fairly cheaply and in a matter of hours. So is it the solution to the reported PPE shortage? Dr. Sam Pashnatala is a research fellow at the University of Sheffield who's part of a team using 3D printers to create parts for protective masks. He says it's a step in the right direction.
On its own, 3D printing isn't the technology that's going to save us in the PPE crisis. It could be part of the solution. The advantage of 3D printing is the versatility. One day we were producing models for engineering students' projects. The next day we were producing parts for these face shields. We're trying to harness all makers, so all people across the country who have access to a 3D printer. Can they get on it? Can they start producing parts that we can then assemble into personal protective equipment? It's really the first time maybe when there can be a sort of a nationwide or I guess even a global-wide call for people who have access to this equipment to try and do something with it to combat, a global situation.
The number of global deaths linked to COVID-19 has reached 100,000. And while the UK saw its deadliest day yet with 980 deaths, New Zealand has one of the world's lowest death tolls. 2 people have died in the country, which has been in lockdown for 2 weeks. The Prime Minister, Jacinda Ardern, has been clear in her goal not to contain the virus, but to eliminate it altogether. Giovanni Torre is a journalist covering New Zealand. He says the key to the country's success in tackling the virus is the speed with which it acted.
They had just over 100 confirmed cases when the Prime Minister said, we've got 48 hours before we go to a level 4 lockdown. The schools closed, a bunch of public venues closed, very strict social distancing protocols were put in place, internal flights banned, the borders sealed. At the moment, there are 16 patients in hospital with COVID-19, which is extraordinary. And so their health system's not being overwhelmed, which is what devastated Italy. And it's playing out that way in a few other countries as well. In terms of the role of luck and New Zealand's geographical position, New Zealand is geographically remote, but it's also very popular with tourists. They have about 3 million tourists a year. It's a huge part of the economy there. So it is a situation that could have been much worse in terms of the immense popularity that New Zealand has with tourists. And the modelling that the government released in late March projected what would have happened if the government hadn't acted decisively to slow the spread of the disease. And they predicted that more than 2/3 of the country's population would have become ill and over 27,000 die. 27,600 people in a country of less than 5 million would have been a massive loss, just really dreadful. But the measures in place appear to have averted that disaster. New Zealand has been very, very clear. They've said, we're keeping the border restrictions in place, strengthening them, and we're going to continue to work towards eliminating the illness in this country. And once we've got a vaccine here, then we'll allow visitors from outside. It is an incredibly strong stand and will probably be vindicated by history.
Deaths with coronavirus in UK hospitals are broken down into age, sex and region. What we don't know is the victim's race, a factor you'd hope would be unimportant. But in the United States, which does publish deaths by race, the figures will make you look twice. In Michigan, black people make up 40% of deaths, despite representing just 14% of the state's population. And in Chicago, black people represent around 70% of fatalities, but only make up 30% of the population. Early research suggests the UK might be seeing a similar trend. The Intensive Care National Audit and Research Centre found that individuals who identified as non-white accounted for 1/3 of 2,000 patients admitted to critical care, despite making up only 13% of the UK population. There are some genetic factors. The South Asian community, for example, is 6 times more likely to have type 2 diabetes. But Muhammad Ali, health policy candidate at LSE, says it's not all down to health.
When you consider the social distancing measures that have been applied across Europe, this hasn't been possible for many households in the UK, especially in the BAME community. The majority of BAME community live in poor quality housing. So the lockdown means more time exposed to, say, cold, damp and other hazardous conditions. And many people from the BAME community many generations live under the same household. So many early research has seen is that younger people are actually the vectors of COVID-19, and it's them that is bringing the virus to the houses themselves.
Every great charity appeal needs a soundtrack, and it seems only right that the Telegraph's coronavirus appeal has its own theme tune too. It would need to be something catchy. It would need to reflect the unprecedented and often quite bizarre circumstances we're living in, and ideally it would need to be a bit of a laugh, because we could all do with one. Enter comedian and writer Tony Hawks, who's come up with just the thing.
Life is a bind, I'm in lockdown, completely resigned to lockdown, and I'm slowly going out of my mind.
His song Lockdown is out now, with proceeds going to the Telegraph coronavirus appeal, which is raising money for Turn to Us, a charity providing emergency grants for people in the UK hardest hit by the crisis. I've put the link to the music video in the show notes. You'll spot Stephen Fry, Rob Brydon, Sandy Toksvig and plenty of other familiar faces, as well as the link if you'd like to join us in supporting those struggling to make ends meet. This is Coronavirus, the latest from The Telegraph. I'm Theodora Laludis, and I'll be back on Monday evening with another update. In the meantime, you can access all of our news, analysis and advice completely free for the first 30 days. Go to telegraph.co.uk/audio.